I started thinking that I had schizophrenia whenever I started hearing voices and having delusions.
When you have schizophrenia and you're having an episode, you can't distinguish the difference between reality and falsehood, so it seemed very real. It's kind of like living in a nightmare.
The Eagle program is a very supportive environment that enables us to thrive in this world that we live in right now with our conditions.
We provide medication management services, therapeutic services, supported employment and education, peer support services, and then family support.
Everyone in the Eagle program is there for your personal development and your personal betterment. After being hospitalized and seeing all the help and all the work they did and all the information they gave me towards my illness, I changed my major to become a psychologist so I can help other people with mental illnesses.
I feel like I'm at a high point in my life. Therapists in the Eagle program have really helped me to be more successful.
With the Eagle program, we believe that if we give you or help you or provide you with the tools and support you need to be successful, then you have the ability to soar.
Elise was born with a lot of medical issues and spent a significant amount of time in the hospital when she was first born. But she always kind of had one fear kind of after another, fears that weren't really getting better, and it was stopping her from living life.
50% of the population that has a mental health illness can identify that their symptoms were there by the age of 14. Even though we started in primary care, we knew we had to get further uphill. And 3 years ago, we said, let's go into pediatrics. So your child goes in, does a screening tool, or if you request help and your pediatrician needs that support, by one phone call, they contact our team and we are able to do a psychiatric assessment over video.
So we came in and she did an assessment which showed that she had anxiety.
Following that assessment, we get a treatment plan that the primary care physician or the pediatrician will incorporate, and then we get a patient-specific callback protocol where we provide support not only to the child, but to the family members.
It's just really invaluable to have everybody working together and to be able to have it in the same practice that knows my child so well is just a great thing to have.
My father was an alcoholic. It was just chaos all the time in our house because of his drinking. I didn't want to be my father, but I became my dad. I could be whoever you wanted me to be to get whatever I needed. And it got dark at the end, and so I drank and used, and I wanted to die every day. I remember it was July 24th, and it was 100 degrees outside. It was going to be a meeting, but there was a bar that I used to drink at, so I had to make a decision which one I was going to go to. And I went to the meeting, and that's where my journey began, was that day. I never diagnosed myself being mentally ill. I was always taught, come on, cut it out. Act like a man. But then I come to realize it's a disease. For years I thought I could do this on my own. Get well, I couldn't. There's people out there that are willing to step up and to give you hope and to walk with you through this. I joined Atrium Health in 2010, and I became a peer support in 2016. Who would know better than a drug addict and an alcoholic to talk to another drug addict and another alcoholic? I can only give them my experience and what I've been through and share bits and pieces of my life. And say, you know what, I'll jump down in the hole with you and we'll stop digging, but we'll be together through this as we climb out.
One thing that I will always be grateful for is Atrium Health. Primarily it's because they've given us an opportunity to take an idea and do something that is worthwhile, and something that can change lives to our community.
I am so happy that I had the chance to be able to come here and do this, because if I haven't, I don't think I would be alive today.
I'm a person in long-term recovery. I'm a father, I'm a grandfather today. My grandchildren never see me drunk or high. What I have inside is the most important thing, and that's my recovery, my sobriety.
Atrium Health has been very helpful for me and for my family. I don't think that we would be where we are now if it weren't for this group.
So thanks to Atrium Health and thanks to all the support group I had, I've been able to pursue what I want to pursue, and I know it is going to really make me happy in the future now.
It's made a huge difference. Elise has become a lot more outgoing, just much more willing to kind of try new things and do new things that she would have never done before. She's sleeping much better. She's having better dreams. It's a whole new child.
I'm so grateful to the staff at Atrium Health for bringing me through this journey. They're so kind and they're so encouraging. It changed my life.